You need to stay through the presentations.
No, I just talk.
Thank you so much.
Good.
Is that okay, or do you need to be mic'd up?
Might be easier to be mic'd up. Yeah, a lavalier. Can I get a lavalier?
Yeah.
I like to walk around.
I got you. You want to put that on your collar?
Oh, okay.
While he's micing up, I got one thing. This is just a reminder, too, that we're very fortunate to have Carrie Morgridge donate books. The books are listed for $19.99 online, but we're offering them today for $10 a piece. So all of those funds come back to Guardians for New Futures. Okay, so please buy a book. It's only $10. Thank you.
Yeah, great. Well, good afternoon, everybody. I hear you all have had a good day today. I'm excited to be here and to talk with you today. I'm Dr. Beau Nelson, and I work for FHE Health. We're a treatment provider for behavioral health services in Deerfield Beach. I have been in this field for going on 20 years. I am what's called a doctor of behavioral health. And most people look at me and they go, okay, well, do you write prescriptions? And I always go, no, I don't do the prescription sides. So I really function like a psychologist. I was trained in working in primary care settings and working with people who have all kinds of health issues, mental health issues, and anything under the sun. So I basically do everything but prescribe. And so I work with people from anything from nutrition to suicidal ideation to addictions to chronic pain, anything like that. So I got started in this field about 20 years ago. I was a social worker for many years, a professor. I have used to do electroconvulsive therapy. Many of you will know that. It's not like the movies at all. But for a lot of folks, getting access to services and getting treated is often a big issue. But one of the biggest things that we often see is that people who work in human service professions like you guys, and people who are often in really very difficult kinds of situations with families, kids, and people who are suffering, is that there's a lot of issues with what we call caregiver burnout or caregiver stress. And so I'm going to be talking a little bit today about how the body works and how it responds to stress. I'm going to be talking with you about some warning signs of what we need to be watching for. And then I'm going to be giving you some things that we can be able to do to be able to help ourselves, and you can also be able to help others. So first off, how many people have been working in the health and human services fields for more than 5 years? Okay, how many more than 10 years? Well, how many more than 20? More than 30? We've still got a couple. Yay, good for you. You're a rare bird. It's really important that you think about after 10, 20, 30 years, think about all the things you've seen. Think about how your life has been impacted by your work. Think about what you've actually gone through in the course of your life and how things have changed. Stress is a reality, and it is part of our lives. I want to look at two types of stress that are important. So one is called acute stress, and one is called chronic stress. So acute stress is very normal. It happens. It's usually situational. It comes and it goes. Not a big deal. A big issue, though, for caregivers is chronic stress. And chronic stress usually leads to burnout. So I'm going to talk to you a little bit about how the body works. So stress is actually a release of chemicals in the body. So what happens is that when the body or the mind starts to perceive a danger, and it can be real or imagined, then what happens is that the body starts to respond by releasing chemicals. So the way the body was formed is we have our brain stem, which actually controls kind of the basic functions of our bodies, like our heartbeat and respiration and just kind of the basics how the body works. And that was the first part of the body to form. Then we had kind of the processor of the brain, and inside of there's a little gland called the amygdala. And the amygdala is a little bit bigger than an almond, but that is the fear center of the brain. So it stores all your fears. So when cavemen were walking around and they were going, they didn't really think a lot. You know, they weren't going, what's going on with the stock market? They were going, okay, I got to stay away from danger. And we've often heard of fight or flight. And so that's what's controlling that. And what happens is that little gland is so connected to the brain stem that often you feel the anxiety and the stress, you get the fight or the flight syndrome, and it happens so quickly because now as we've developed what's called the frontal cortex, which is kind of our thinking part of our brain, where we're able to process information, figure things out, and do stuff, what happens is it takes longer for that to click in before it can stop the reaction. So the body releases a bunch of chemicals when you get stressed. And those chemicals can become toxic in your body. So your body is always looking for homeostasis. It's always looking to kind of keep itself balanced. And so if you eat a really salty meal, then your body tries to take that salt out of your system and get back into equilibrium. Problem is when stress chemicals are released, the body doesn't just get rid of them. The fact is they can actually stay in your body. And so there's a bunch of things that are released, but one of the chemicals that's released is called cortisol. And have you ever had a hard time losing your belly fat? Anybody? Anybody? Yeah, I can see a few hands. Right, you go, oh my gosh, why can't I seem to lose this belly fat? Well, that's actually from a chemical called cortisol, and that's an effect of chronic stress. And so you can eat right and you can exercise, you can do all these things, but if the stress level is still high, you're going to keep that big midsection. And so one of the things, don't look around at the next person and go, oh, you got a lot of stress, right? And don't go home and tell your doctor and go, it's just stress, because that doesn't work either. Okay, and we're going to talk about how to control your stress and take care of yourselves too. But what it does, it actually creates what's called visceral fat. And this fat isn't just under the surface, it actually grows around your organs. So over time, stress can become a really physiological problem for a lot of people. If you have cardiac issues, if you have hypertension, you're going to actually notice that your symptoms are going to get worse over time. So for a lot of people, we say, okay, we look at caregivers and we say, okay, who is the last person who the caregiver takes care of? Ourselves. And each one of you is like a ripple effect. Because one of you can make a difference in 10, 20, 30, 40 lives. 50, 60. You've been working for 30 years, it could be hundreds and hundreds and hundreds. But the problem is you give so much. How many of us are better advice givers to other people, but we don't do it for ourselves? Okay? I always tell people it's kind of like losing weight. We all know how to lose weight, right? Okay, so less in and more out. Not hard to do, but we can't seem to do it, can we? But if you had a friend that came to see you and they talked to you and said, I want to lose weight, boy, I bet you'd be right there for them. I got you recipes on the internet. Let's go walking. We're going to do all these things. Let's join a gym together. I'll go with you to Zumba, whatever it might be. But when it's you, it's, I guess I'll watch another Game of Thrones, right? Oh, I'm too tired. I can't do it. And a lot of people mistakenly think that motivation comes first and then action. And this is true in anything in life. That's actually wrong. You don't motivate yourself into action. Action creates motivation. So when patients come to see me and they say, Dr. Nelson, I need to lose some weight. And I tell them, I said, okay, I'm going to give you your assignment to work on. And they say, okay. And I said, what I want you to do is I want you to get a time in your day that you're going to take for yourself to exercise. And they say, okay, well, I'll do it, and they'll tell me, I'll get up at 4 in the morning. I'm like, let's be realistic, okay? You're not doing anything now, and now all of a sudden you're going to get it for us. So I say, let's pick a 7 o'clock, I can do it. Okay, great. So for the next week, I want you to get up at 7 o'clock. I want you to put on your gym clothes. I want you to get in your car, and I want you to go to the gym and stand outside the door for 5 minutes. And they look at me and go, I'm paying for this? And I say, okay, we'll go do it. So what I see, usually 2 camps happen. One is people will go and they'll go to the gym. Some people won't go at all. So I got to work with these people to kind of get them going. But the ones that go and they stand outside the gym, a weird thing happens. They're standing out there, maybe having a smoke or something, waiting out the gym, watching all these people go in. And what do? They go in the gym. And it may be 10, 15 minutes. So they come back and see me and said, okay, I did it, but I went in and I actually worked out. And I said, what did you do? And I got on the treadmill for 10 minutes. And I said, well, you didn't do your assignment correctly. But that's okay. I said, now what I want you to do is I want you to go, but I only want you to work out for 15 minutes. So they go to the gym. And what happens? Well, I got some who don't go at all. Well, I got to work on them even harder. Get out the rubber hose. And then I get the ones who go and what happens? They stay longer. I did 30 minutes. I come back and I say, well, you didn't do your assignment correctly again, but that's okay. And let's keep working. And after a certain point, what happens is they've done something. And when they do something, then all of a sudden they start to see benefit. They feel different. Your body doesn't change overnight. And you can't go to the gym once a month. Like maybe, Suzanne Summers, tells us, you get this product on TV and you're just going to all of a sudden, look like a swimsuit model. That doesn't work. You got to do it consistently. And caregiving is consistent, and giving care to yourself has to be consistent. And that's when you start to see results and you start to take care of yourself. Because I'm old enough now that I don't remember everything. I'm going to talk to you a little bit about factors that can lead to burnout and see if anybody sees this. So one of them is, we call it role confusion. So when people they're kind of confused when they're as a caregiver because they only become a caregiver. You lose sight of the other things that you do. Have you ever been in a situation where you put your kids second, or you're too tired, or you take out your anger on somebody, or you forget your spouse or partner, and you just don't seem to have time for them? And after a while, it becomes so kind of all-consuming, and you don't take care of yourself. When I was a social worker, I remember being in school, and it's like you take a vow of chastity and poverty, to be a social worker, and people, were all like, oh, I'm going to feed the hungry, and I'm going to save the world, I'm going to get these kids to feel better. And I said, well, I'd like to make money. And they were like, well, you're in the wrong program. But that's exactly what happens, is that we almost become all caregiver and nothing else. You can't be a one-hit wonder. We often have unrealistic expectations. How many times have you said, I want to save this kid? I want to make a difference. I want to make this person happy. Well, one of the things you got to learn in life is you can't give feelings. You can't make everything all right. And a lot of times this really leads to the burnout. Because we come in with big ideas, don't we? Kind of like going into a buffet. And you're like, oh my gosh, this looks great. But after a while, your eyes are cashing a check that your body can't take care of. And that's what happens a lot of times in our careers, is that our expectations are so high and we're trying to reach some kind of goal, and because we keep pushing and pushing and pushing and pushing ourselves, it takes a toll on us. Lack of control. You can't do everything for everybody. How many people have had a client who's come to see them and everything's out of whack? Everything. You've got all these different problems. it's too much. We try to coordinate services and care. I worked in primary care for years. And in primary care medicine, only 5% of referrals for mental health services from primary care are actually followed up. Only 5%. So now, family practice and general practitioners write 80% of the scripts for psychotropic medications. And they're not trained on how to do this or the warning signs of depression or anxiety. And we see in studies that before people commit suicide, they have seen their primary care physician in the past 3 months. But there was no assessment done. How many times has your doctor ever asked you about your mood? Yours have? Good, that's great. Yeah, but Medicare's not really good at making anybody do anything. So many don't. But now we try to do screenings. We even have tools that are used. But that lack of control, you can't do everything, you can't see everything. But the fact of the matter is that we're just kind of get stuck in this situation. And when we have the opportunity to ask for help or to do something, it's very difficult for us to do that. And that's one of the things as a caregiver that's really tough, is sometimes asking for help for yourself. Because it just doesn't feel right to us. I work with a lot of first responders. Police, fire, EMS, corrections officers, military, and they are the worst at asking for help. They never want to ask because they've always been in the role of being the person who can help. And the same thing in human service professions. We're supposed to be the one who knows better. We're supposed to be the one taking care of stuff. And the fact of the matter is we're not really good at asking for help when we're not doing well. We put unreasonable demands on ourselves and sometimes others. Is that a big part of this? Is that we really want everyone else to be giving 100%? We want everybody to be able to reach their goals. We want all this stuff. And sometimes we push so hard that it really impacts our personal relationships, our health, and our functioning. So we talk about signs and symptoms of caregiver burnout that we look for. I won't ask you to raise hands on this one. But let's talk about one, altered eating patterns. So how many people eat more when they're stressed? Okay. How many people eat less? Okay. I'm going to eat less. So I've been doing this for 20 years. I run a facility. I have 220 employees and 165 patients right now. I work 24 hours a day, 7 days a week on call. I have 130 groups that are run every week. I run neurosciences, so I actually treat the brain, and all the clinical services. And so there's plenty to keep me busy during the day. When I moved down to Florida 5 years ago, I retired. And I know I look young, but I retired. I found out that I was more stressed when I was retired. I put on 30 pounds and was miserable. I found out I needed to be busy. How did I not know that about myself? Well, human service professional, I didn't even recognize it. So I ended up going back to work. I'm the most blessed person you'll ever meet in your life. But we still suffer from stress from time to time. But you have to learn how to take care of yourself. Eating is not a way to make you feel better. And not eating is certainly not going to make you feel better. Increased sugar consumption or use of alcohol or drugs. So our body, when we're in stressful situations or we're depressed, craves certain foods. Like when you're feeling depressed, how many people like carbs? Anybody? So you hit the mashed potatoes, the bread, the chips. You're going for it. Why does your body do that? Is that just because we're just bad people and we shouldn't be doing that? No. Carbohydrates are the basic building blocks of serotonin in the brain. Serotonin is the happy chemical, right? So people are, spending thousands of dollars on pills to get more serotonin, but your body does it naturally. So if you go on a carbohydrate-free diet, carb-free, most people start to mimic depression symptoms. And they think it's just because they're denying themselves that wonderful piece of bread. But it's not. After a while, your body doesn't have the basic building blocks. If you are on a fat-free diet, cholesterol is the basic building block for sex hormones. So if your partner goes on a cholesterol-free diet, go get a library card. Because you're not going to be seeing much of them on their fat-free diet. And that's really important, right? So the body knows what it needs, and sometimes we don't know what we need. But we do have a high risk for alcohol and drug use when people with chronic stress look for escape mechanisms. How many people, I got to have that glass of wine at night. You know, I have a picture in my office when I used to work in a clinic. And I would always try to teach both my patients and my students, as always people would say, I have one glass of wine a night. But I had this picture, and it had this glass of wine that's like huge like this, you know. Or I've learned over the years, I say, well, you have one glass of wine, how quickly do you go through a bottle? And people are like, well, they use those stadium cups. So one glass is a bottle. And if you're a female and you drink red wine, the tannins in the wine can make you very upset and irritable. I've had couples come see me, and I talk to these couples, and they get in these fights whenever they go out to dinner. And I say, what do you do at dinner? And they said, we have wine. And I say, oh my goodness. And what happens after that? We get in a huge fight. Women's prone to this more than men. Women's bodies work a whole lot different than men's. Men lose fat real easy. You ever had a man who said, I'm going to start walking, and they lose 20 pounds, and you're eating one piece of celery a day, and you're on that that thing with the shaky weight, and you can't lose a pound. So your body stores things differently. And so it's really important that, like, some red wines can actually start to make you more irritable and upset. I've actually saved a lot of marriages by switching to white wine. Hard to believe. If you start to increase smoking, or if you gave it up and you started again, that can happen when you're under a lot of stress and you're burned out. Frequent headaches, or the onset of pain. For most people, it's back pain. You ever notice when you get really stressed that all of a sudden you start to feel more pain in your body? So the body has a mechanism called pain gateways. And so one of the things we have to treat with chronic pain patients is to train their body, if they're depressed or anxious, so that they don't feel the pain and anxiety as much as they used to. I had a patient who came to me in clinic one time. She had been a construction worker, and she had fallen off a ladder. She came into my office in a wheelchair. She was on a slew of pain medications, opioids, and she was afraid of getting addicted. Unfortunately, at that time, she already had gotten addicted. So I worked with her physician, and I started to teach her some of the same things I'm going to teach you all today. And her quality of life was zero. She was basically staying in the house all day, couldn't go anywhere, and was stuck in the wheelchair. I worked with her for about 4 months, and at the end of 4 months, she walked into my office. She was on a quarter of the pain medication she was on, and she was actually in better shape than she had been before she had her accident. It is possible, but a big part of it is what we choose to do. Increased reliance on over-the-counter pain remedies or prescribed drugs. So a lot of times people start popping the sleep aids and all these different things, Tylenol, which all have an effect on your body. Even aspirin has an effect on your body. You may notice that you start drinking more caffeine because your body starts to feel depleted and down. And so when you drink caffeine, the most widely used psychoactive substance in the world is caffeine. And what does caffeine produce? That's a mood problem. Anxiety. So you already got stress, and now you're drinking a lot of coffee. Well, I mean, might as well just hit yourself in the head. There's no point in doing this. But a lot of people do. You'll become impatient, irritable, frustrated easily. You overreact to commonplace kind of things. Small things become big things. You start to get anger outbursts. And often, it's kind of funny when you're a caregiver or a human service professional, it's funny who gets the brunt when we're angry and irritable. Right. You're really good about not doing that with a client. What good professional boundaries you have. But you're hell on wheels when you come home, right? You know, where are the kids? Well, they're not here, right? And other people see all this stuff in you way before you do. So when we talk about it and we say, okay, well, what's really important as we start to look at getting our body in tune first? So one of the things that we'll kind of hit on is sleep. So how many people here would report that they get good sleep every night and they feel well rested? Okay, well, you all go home. Most of us don't. So sleep problems are an epidemic in the United States because of stress. What's the difference between having an anxiety problem and a sleep problem? So this is one of the toughest things that we have. We can't decide which is which. So a lot of people go to their doctors and they say they can't sleep. And they're put on a medicine called a benzodiazepine. Valium, Xanax, Ativan, lorazepam, alprazolam, whatever the drug is. And this is going to help you sleep. And so the problem with it is that's an anti-anxiety medicine called an anxiolytic. And the problem with those is they're only meant to be taken for about 2 weeks. I'm sure there might be somebody here who's taken them longer than 2 weeks. But they're really not. There's a thing called the rebound effect. So anybody who's put on a benzodiazepine is going to have a rebound effect. So if you had anxiety to begin with, and you were put on this medication, when you come off of it, it will be worse than where it started. And there's a withdrawal and a dependency problem with these drugs. But the problem is that they prescribe these drugs, and if you have a sleep problem is based on the chemicals that operate in your body. So basically when you go to sleep, one chemical has to go up and one chemical has to go down. So if we want to take care of ourselves and we want to get better sleep, jot these down. First thing is you have to get away from all screens for 45 minutes before you go to bed. How many people sit in their bed with their phone in their hand? The laptop or the TV on. And you sit there and you go, why can't I sleep? The video waves actually inhibit melatonin, which is the medicine, is the chemical that has to go up in your body to help you to sleep. So 45 minutes before bedtime, you're going to start a routine. And that means one of them is no screen time. They just did a study with people on vacations. Shocker, they had to do a study on this. I wonder who paid for it. If you don't take your phone with you, you actually have a better vacation. Shocker. But they did a study on it, so now it's true. And same thing is true even when you're going to sleep, because it can often, phone dings, dings, dings. It actually, every time your phone dings, it creates a slight anxiety response. Partly because you want to see what it is. They actually did a controlled study where they had people's phones across the room and someone sitting there and their phone would ding and they would rate their feelings and their anxiety would go up. Generally, most people check their phone every 15 seconds. It's the one thing in your life which will always be at arm's length. Think about that. But when you do it in bed and you have your sleep time, it's going to actually inhibit your ability to fall asleep. So get rid of the screen time, 45 minutes before. Second thing that you do is you take a warm shower. Not a hot shower, but a warm shower. Temperature is very important for sleep and quality sleep. So it's important to take a warm shower, and then your bedroom needs to be cool. How many people sleep better in the cold? I turn my air down to like 68, right? And I got a quilt on, and I'm like, it's, August in Florida, and I'm like, like I'm something out of the Arctic. But I sleep good. Very important. Your bedroom space has to be for two things. Unless you're on the cholesterol-free diet, it'll be sex and sleep. That's all your bedroom should be for. I had a patient come see me, and she said, Dr. Nelson, I had terrible sleep. And I said, well, tell me about your sleeping space. We call this sleep hygiene, so they have to have a fancy medical name. And I said, tell me about your sleeping space. And she says, well, I've got my bed. She said, I got my desk next to the bed, and I work from home. And then I've got my treadmill on the other side, and I've got a 60-inch TV at the end. I said, my goodness. I said, YMCAs don't have this many activities. So your body has a sense memory. And so if it's going to that room to exercise and do all this other stuff, it actually knows that. Did anybody ever remember going into your grandmother's house when you were a kid and you felt good? Or maybe you went into church or synagogue or something and I felt good. Or you were, your favorite restaurant, this is so nice. Your body remembers places. So you got to have your sleep space, it's got to be a dedicated space, and it's got to be kept for just that. So that's very important. Other things to do. Start to learn a meditation. Listen to something that helps to relax you. If anxiety is keeping you awake at night, you're going to notice because there's one thing that happens. It separates insomnia from anxiety. Insomnia means my mind is blank and I can't sleep. Anxiety means my mind is racing and I can't stop thinking. And that's what happens. All day long you're running around. And you're going and going and going and going. Remember, we're not really good about seeing our stress when it's chronic. We don't really recognize it because we're always running at that higher level, right? But what's the one thing that happens? When you get to bed and your head hits the pillow, there's nothing going on. And what happens to your brain? It just starts running. And you have nothing other than just thinking. So I'm going to teach you one of the ways to reduce anxiety and stress. Put your feet on the floor, sit up straight in your chairs. This is a technique that is very helpful. I have gotten patients off of Xanax by just doing this breathing exercise. It's called diaphragmatic breathing. And I'm going to explain to you why it works. So basically, when your body gets stressed, you start to breathe from the upper part of your lungs. And that shallow breath, unto itself, will release the stress chemicals in your body. So what we want to do is we want to get deep breaths to go through our body. So what we do is you breathe in through your nose for a count of 5. 1, 2, 3, 4, 5. Hold it. And then out through your mouth for a count of 7. 1, 2, 3, 4, 5, 6, 7. And when you breathe in, you want your belly to go out. That's pulling that air in. When you do that, it tells your body that everything's okay. And your body will stop releasing the stress chemicals. So let's practice it just for a minute or so. So in through your nose, 1, 2, 3, 4, 5. Hold it. Out through your mouth, 1, 2, 3, 4, 5, 6, 7. In through your nose, 1, 2, 3, 4, 5. Tummy going out. Hold it. Out through your mouth, 1, 2, 3, 4, 5, 6, 7. In through your nose, 1, 2, 3, 4, 5. Hold it. Out through your mouth, 1, 2, 3, 4, 5, 6, 7. It works. And if you do it at bedtime, and when you're laying there and you focus on your breath, you will fall asleep that way. It will calm you down. So we talked about sleep. Second thing that's very important, nutrition. We've already talked about how the body craves and needs to be able to have the basic building blocks for the things that it needs to operate at its best. So you got to look at your food intake. We kind of all know what healthy foods are and what unhealthy foods are. But I'm going to talk to you a little bit different is about spacing your meals through the day. How many people skip breakfast? How many's breakfast is a cup of coffee? Well, God, your anxiety goes up in the morning. I've heard this before. I had a patient who had a coffee pot at her desk. And she came to me. She's like, "Doctor, I don't know. I'm just anxious all the time." And I was like, "Okay, well, tell me about it." And she was drinking 3 pots of coffee a day. She thought I was a miracle worker when I said to switch to decaf. And she also, "My sleep has really improved, and I feel so much more at peace, and people like me now." And I was like, wow, hard to believe, isn't it? Same thing with nutrition. If you think about just making a 5% improvement in your eating habits, just a 5%, what would I do differently? One of the things is your body needs food throughout the day. If you suffer from with diabetes, then your doctor will tell you got to even out your blood sugars throughout the day. And that's really true for all of us. See, the problem is that our body vacillates between starvation mode, which means it pulls everything in and holds on to it, or we so oversaturate ourselves that the body has nothing else to do but then put it back in. So when you actually go and you don't eat at all, every little bite of food you get, your body holds on to. So you can't starve yourself. I don't know how many people have tried that diet specifically, but the idea is you can't do that. You actually, the easiest way to lose weight is to have regular meals throughout the day. Of course, it depends on what you eat. So every 3 to 4 hours you need to eat. And for a lot of people, it's the choices of food that they make. So what do we talk about that's healthy? So there's lots of colors in our vegetable garden, right? Each color represents a different nutrient. So when you look at your kids, or you look at kids, what is the favorite color for food for kids? Brown. Chicken nuggets, French fries, bread. Oh, they love brown. But you put anything green on that plate? They did a study with NASA up in space, and they had this special grow light that was able to grow vegetables, but things looked different. So broccoli was purple, and no one wanted to eat it. Your body is programmed for what things are okay. And part of it is you have to reprogram yourself a lot of times. And you got to be smart about the way you eat, but you need to have a variety of your foods because those are the basic building blocks for how you feel. So stressed out people tend to eat high processed foods because they're so busy and they're on the go all the time and they don't have time to eat and they're eating in the car, and you go by their car and you're like, my goodness, someone likes McDonald's. This is what happens. And so we actually deplete our body of what we need as nutrients. And that will start to affect us both in our depression and anxiety and stress. And so it's important to eat a balanced diet. Small meals throughout the day, and then a balanced meal. Nothing too much. We always talk about the plate method. So you put a plate with a cut down the middle, and then you put one to the side. And so your vegetables go on the big part of the plate, your meat, big as your fist, and then carbs, which could be healthy, like complex carbohydrates, like wild rice or whole grains. Those are fine. Don't eat white rice. I tell you, I've really helped a lot of patients. They now have a thing called riced cauliflower. I hate cauliflower. I have never liked it. Somebody just said they love it. Oh, you love it? Yeah. But I had my nutritionist who works for me. She does food demonstrations for our groups. And so she teaches patients how to be able to eat healthy foods. I used to be a diabetes educator for many years, and I wanted a nutritionist like this lady. And she made a thing with riced cauliflower, which you can get in the freezer section, and she used it in place of white rice. I could not even tell a difference. And I've been doing this a long time. I actually have a friend of mine who is an oncologist at MD Anderson, and he treats cancer with Vedantic medicine, which is a Indian and a Eastern kind of way of treating disease, because most of our medicines come from plants or some kind of natural elements. So he teaches through nutrition how to help people. Well, he's an oncologist. And he was sharing with me about how he uses turmeric, the root of the turmeric plant. It's called curcumin. So the basis of all disease in the body is inflammation. And your doctor will often throw at that. And what do they give you? Here's a pill for inflammation, right? But what he did is he started to treat cancer with curcumin, the turmeric plant. And people went into remission. He actually had patients who were in full remission simply with taking this medication. No side effects, nothing bad, but as soon as they got off of it, the cancer came back. That's how powerful nutrition can be to your body. So it's very important that you watch both the quantity and the quality of what you eat. If you eat out every meal, you're in danger. Have you seen now how they have the menus with the calories on them? And when you thought, oh, I'm having this healthy salad, and it's, remember a 2,000 calorie a day diet, that's really for kind of a man. So if you're a lady and you're eating 2,000 calories a day, it probably going to kind of affect you. But they always use the 2,000 calories. And you start to look there and you realize that, your healthy salad is 1,800 calories. And we're just at lunch now. You've got a good half day of eating left, And that idea, you don't get too caught up with the calories and this and that. It becomes a little kind of daunting for you. But the idea is that for a lot of us, our hunger is actually more psychological than it is physiological. I mean, people come in and say, oh, I'm starving. Please, drama, right? Yeah, you're starving. Yeah. But this is what we do. We tell ourselves, and then it's like, how many times do you go and you say, oh, look at that chocolate cake. I've got to have a piece of that chocolate cake. Oh, my God, I have had such a tough day. Oh, these clients are all late. I can't, traffic's been horrible. I need a piece of chocolate cake. And you eat the piece of chocolate cake. Now what do you feel? I shouldn't have eaten that chocolate cake. Why did I do that? Oh, that was so terrible. Funny how this inanimate object has gone from kind of the saving grace of your day, and now you're beating yourself up over it. Well, see, that's the psychological process around food. So a little handy tip. And remember, this wellness and taking care of ourselves is about everything. So one of the things you can do is if it's psychological hunger, drink 2 8-ounce glasses of water and wait 15 minutes. If you're still hungry, have a healthy snack. For a lot of people, they just need to crunch. So if you can use something like carrot sticks or celery or whole wheat crackers or something like that, just to get that, because it's a psychological need. I used to be extremely overweight many years ago. And I went on a diet back in the day that was medically supervised, and it was all shakes. And because I had a really bad heart condition. And so my doctor said, I was 20 years old and probably going to die of a heart attack in 6 months. Pretty bad, right? I grew up in the South, though. So I didn't know that food didn't come fried off the farm. I didn't know there was something other than whole milk, right? And butter was just on every counter. So bad habits. So I lost all this weight, but I remember I needed to crunch something. And I remember the doctor said, I can't eat. If I eat solid foods, I'm going to get sick. It takes about 15 minutes for your body, your brain, to realize that your stomach is eaten. How many people have eaten their meal in 15 minutes? Right. Well, here we are, stressed again. I don't got time to eat. No. Oh, I'm going to take a lot of time with my client, and the problem is your body doesn't realize it even eaten. So one of the things we tell about with healthy eating is don't watch TV, don't do anything except sit down at the table and look at your food and eat. You will find, practice it, you will find that you will get full faster. Because it's conscious eating. Anybody ever heard of mindfulness? Mindfulness training? Yeah. So mindfulness is about another healthy thing that we can do, is being present in the moment. So part of it is if you're worried about yesterday or a year from now, and a lot of our stress is about things we think are going to happen. You know, we're very different than our ancestors. They were facing real fears and dangers, and that little gland, remember the amygdala, would click on so it would save them from something. The problem today is that all of our fears are, oh, what's going on with my 401k? You know, oh gosh, what's that party going to be on Friday? You know, oh my gosh, how much is it going to cost to get my car fixed? Or whatever it is. And we just keep thinking. And what the body does, which increases our stress level, is that our body keeps telling us that if we keep thinking about it, we're doing something productive. Because there's nothing we can actually do about it. And by creating that, that's that same racing kinds of thoughts, that anxiety that we feel. But healthy nutrition, sleep, exercise. Now, most people way overshoot when I talk about exercise. Recommendation is 150 minutes of moderate to vigorous activity a week. So if you can go 15 minutes for a walk, you will notice a change. One thing that it does, if you can do that, is it will actually get those stress chemicals out of your body. It burns them out. So it helps your body to be at that homeostasis. It will also help with depression. Cardiovascular exercise, where you raise your heart rate, oh, that's a lot of heart rate, will actually increase serotonin in your brain. So depressed people who exercise show more benefit. They actually did a study where they had people go see a counselor, and they had them on a treadmill. And they were talking to their counselor where they were on a treadmill. And when people were going just not moving, they got the least benefit from counseling. When they walked, they got a little bit more. And when they had a quick walk, they actually experienced the most benefit from their counseling. I have had a lot of times, I used to have an office, I'm from Dallas originally, and Texas, and I actually had a lot of my really severe patients. We would walk around my office park outside in the sunlight, which also helps. Sunlight helps to get vitamin D into your body. We now know that vitamin D can cause depression, a deficiency of that. Physicians are now giving out pills of vitamin D. But again, get outside, do that. I had patients that often would report, and they said, this was the best session we ever had. And I said, wow, what did I do? Fortunately, it was just the walking. But it does make a difference. And if you can do that throughout the day, you can do 5 minutes, 5 minutes, 5 minutes, 5 minutes, and then you'll feel better, and your stress level will be down. You'll sleep better because your body is tired, and you will actually report better mood. So the last thing that I'll talk about, how am I doing on time? Am I good? Okay. Well, we're at 4:05. How about I'll give me 5 more minutes and we'll all get out early. What the last thing to do is asking for support. A big problem with caregiver burnout is the fact that we actually don't get support and help. And one of the things is by talking to people, by giving yourself an opportunity to share and just get some of your feelings out, really does make a difference. We really have support groups, and support networks are very important. For a lot of people who are caregivers, again, they have very high expectations of what they need to be able to do. So one of the other things that you can be able to do is to be able to talk to somebody. It's not bitching and whining about work or your supervisor or how bad your schedule is or all that kind of stuff. It's really about talking about how you're feeling and getting that support and being able to have some kind of back and forth to be able to know that that's okay. Often human service professionals are kind of the worst people about how they see themselves. So there's a psychiatrist, his name is Dr. David Burns, and Dr. David Burns wrote a book called Feeling Good, and it's the most widely prescribed book by psychiatrists and therapists in the world, and it's based on cognitive behavioral therapy. So I'm a specialist in cognitive behavioral therapy. My teacher was a man named Dr. Albert Ellis, and he taught me, and he actually started cognitive behavioral therapy in the 1950s. And basically it's based on the fact that what you think really does affect how you feel. Because there's no one human emotion that everyone has the same, there's not one human event that every human being has the same emotional reaction to. So if I come into a room and I said, oh, the love of your life is gone, somebody's like, oh, I'm going to kill myself. I can't believe Candy's not my life anymore. And then someone on the other end is like, thank God she's gone. I never had the guts to leave. But if I ask them, I said, what occasioned your feelings? They'll say what I said. But I got 10 different reactions. So the way we think about things is really important. And one of the things is when you're health and human services professionals, therapists, all kinds of people in helping professions, they're often very scared of admitting their weaknesses, talking about their mistakes. They feel like they don't know enough. It's amazing. I can quiet a room of therapists just by walking in. Nobody will talk to me because they think I'm too educated and they don't know anything. And it's like having to draw people out. I train students, have for 20 years, and at the first they are just so, and they're just waiting for me to talk. Like, you know, I got some special knowledge. There is no special knowledge. We're all in the same boat. And the fact is, how many of us have learned from somebody else, whether it's taking care of a client or taking care of ourselves? When somebody gives you permission and says it's okay to feel that way, you know, when's the first time you had a client and you said, I don't like them? I do not like them. I do not like them. You see them on your schedule. Oh, gosh, oh, today's a bad day. Then you see 2 other ones. Oh, I don't like them either. But you don't tell anybody. Oh, hi, welcome. Oh, great. Making lots of progress. You know, the strengths perspective. You know, you're not doing anything, but you're here. You know, boy, we're so excited. You're real. Oh, yay. Oh, God, 2 weeks. 2 weeks, not 1. But the idea is just by sharing and being able to talk about it. Laughter is the last thing. Laugh as much as you can. Another study about studies. A study actually showed, it said, you know, when you're in your car and you're driving home, when you're leaving here today, think about it, I love 70s music. I really was a disco child. And I love it. And I love listening to it. And boy, it can perk me up. Oh, I feel a little Donna Summers, you know. I'm like, oh, I'm feeling good. But they actually did a study and they said not only listening to upbeat music or music you like, but if you sing along with it, it actually releases endorphins in your system. And the endorphins are one of the chemicals that make us feel good. And it helps to reduce stress. So next time you're in the car and you're listening to that song, no matter how bad you are, try to do it when somebody else isn't in the car. Sing to the song. See if you feel different. The secret with taking care of ourselves is that by doing that, we're better available to the people that we work with. We become more resilient. We're able to bounce back better. We call it stress hardiness. You're able to face things. And by looking at taking care of your body and your mind, the cycles that you live in, and the ways that you work with people and yourself, you'll actually end up feeling better. Thank you all very much.